Good morning. Well, on behalf of the TMW Center for Early Learning and Public Health, it is my pleasure to welcome you all to the Rohit and Harvanit conference, Leveraging the Healthcare System to Impact Educational Disparities. In the interest of time, I'll kick off the event and my partner John List will close the day. We are thrilled to have you all here. I'm going to take the next few minutes first to welcome you all, and then really to situate the conference today and why we're here talking about this topic. I'd then like to share some brief remarks about the TMW Center, so I hope you'll forgive me, our work, our mission, our strategic priorities, and some early promising findings from our pediatric work. Finally, I'd like to close by sharing what we can expect from the day and a few housekeeping notes. So thank you. Thank you for being here. I also want to thank Rohit and Harvanit Kumar for their generous contribution, which made today possible. I also want to thank our wonderful funders who have been with us throughout the day. And a big thank you to our partners at Becker Friedman Institute for their support in planning and execution of this conference. It truly takes a team. And most importantly, I want to thank our incredible team at the TMW Center for Early Learning and Public Health. As you can see, we have a small but mighty and organized team, and a special shout out to Snigdha Gupta, who has been working tirelessly on this conference. I need to speak up louder. All right. Finally, I want to acknowledge the attendees who are joining us upstairs. We had an overwhelming interest in this conference. So in an effort to accommodate everyone and those who registered after we were full and those on the wait list, we decided to live stream it and add an upstairs room. So rest assured for you all upstairs that you will be part of the conference, and we will talk and see you during breaks, and your questions will be able to be asked as well. So it doesn't bear needing to be repeated, but as you all are well aware, why are we here today? The science is quite clear that disparities in early language and learning environments have a profound impact on the foundational brain development of children birth to 3, especially impacting those children born into poverty. These disparities grow exponentially through a child's life, negatively impacting educational and life course outcomes. For the past 50 years, we as a country have been working tirelessly trying to impact this issue without significant impact at a population level. In recent years, as researchers and policymakers have looked for new and innovative strategies, there's been increasing focus and really momentum around leveraging the healthcare system to advance educational outcomes for children. And it makes sense. I know all of you all are part of the choir that we would look to the healthcare system. Much like the K-12 space has school systems to work and impact children, the first 3 years of life doesn't have as an obvious infrastructure. And the healthcare system with its vast and existing infrastructure is an opportunity that can be tapped into. In addition, there are new universal access and entry points, such as the universal newborn hearing screen that 98% of all children get. There are repeated and predictable touch points, 12 touch points in the first 3 years of life during well-child visits. Healthcare providers are a trusted source of information. The reach of Medicare and CHIP, providing almost 40% of American children under age 6 and the vast majority of poor children make it a far-reaching and influential player that we hope remains. Yeah. And despite my grumbling often about EPIC and electronic medical records, the healthcare's reliance on data and technology makes it well positioned to answer questions about the impact of interventions and really to follow children longitudinally. Which brings us to why we are here today. For our inaugural conference, we thought we would like to convene all of you all, Many of you all are already working in this space, convening intervention developers, pediatricians, practitioners, policymakers, and researchers for a stimulating discussion around the role of the healthcare sector in addressing educational disparities on children. I'd like to now just share a little bit of my background and why I'm here today and why we're all here today. As many of you all know, I am a surgeon, a pediatric cochlear implant surgeon, and the journey that brought me here today actually started in the operating room, not even the clinic. About 12 years ago, I started the Pediatric Cochlear Implant Program at the University of Chicago. Cochlear implant, as most of you all know, is an amazing piece of technology which allows a child born deaf the ability to hear, to talk, and most importantly, to mainstream educationally. It wasn't long before I realized, though, that the miraculous potential of a cochlear implant came with a very large asterisk. And what I found completely changed the course of my career. What I observed after surgery was that despite giving all these children the same ability to hear words and sounds, that great disparities emerged after implantation. Disparities that looked like they wouldn't ever disappear. And it was with that I decided that I wanted to gain a better understanding of why this was, and importantly, what I could do about it, and set off to build an incredible team that I could partner with to both develop and test interventions that might have impact. In the last, and what's very interesting is that while that story may make most of you all think, well, that's why we're having a conference on leveraging the healthcare system. Amazingly, in the beginning, I actually didn't even look to the healthcare system for implementing programs. I looked to home visiting because that's where my families actually received interventions. But it wasn't long before I circled back to the healthcare system, seeing all the incredible assets that it brings to impact families. So over the course of the last decade, my team and I have developed interventions to meet families where they are, in systems that they already navigate, to enable them to see their potential and ultimately to impact their foundational brain development. Since 2010, we have developed and tested through 11 studies, 7 randomized controlled trials, many interventions interacting with the healthcare sector. And while we've reached almost 3,000 children in the Chicagoland area, our work continues to evolve. Over time, we have added interventions that took the core components of our curriculum and made them accessible to parents as they intersected with different parts of the health or social sectors. We are now embarking with partners together we will embed these interventions across entire populations. I'll say a little bit more about this later. And while we intentionally aren't presenting our work today during the conference, forgive me if I take a few minutes to share a little bit more about the center that we've recently started. The mission of the TMW Center for Early Learning and Public Health is simple. It is to impact at a population level parents' knowledge, beliefs, and behavior around developing their children's foundational brain development in the first few years of life. The creation of the center, which is really a joint venture between the Biological Science Division and the Social Science Division, was started with myself and my partner, John List, here at the University of Chicago. He's from the Department of Economics. John's work that he brings to the early childhood space is really focused on conducting large-scale experiments to understand which interventions work along the educational continuum, particularly in the preschool years, and which have significant and lasting impacts. Together, we analyze the impacts of interventions and develop models on how to best scale and test interventions at the broader scale. As a center, we're really pursuing 3 main pillars of work. One is to continue what we've been doing, developing evidence-based interventions and tools for the early childhood space. Next, which is quite exciting, to demonstrate community-wide proof points, models that others can then replicate or adapt. And lastly, to advance the field. And I'll just talk a little bit about them briefly. While we don't have time to talk about the interventions today that we've been developing in our program, it's important to note several things related to our interventions. They're all tech-based and human-assisted. They use a teaching tool that we've developed called the 3 Ts. Many of them use videos and employ behavioral nudges and feedback, thanks to the incredible team that we have. They're all grounded in asset-based parenting approaches or growth mindset approaches to parenting, where parents understand the critical role that they have in building their children's brain. And lastly, as we adapt them, the content is quite similar, just adapted for the different audiences. I'd like to just mention one of the studies, that randomized control studies that we're currently following that's using the health-based sector, the pediatric well-child visits. We are in the midst of a 2-year study following about 400 to 450 families that uses the well-child visit of 1, 2, 4, and 6 months. While I don't have time to go into the actual interventions, I wanted to share some of the exciting results. The ultimate goal of the study is really to say, can, through the simple intervention, we impact parents' knowledge and beliefs, importantly behavior, and then importantly child outcomes. Today I'll share just a little bit of our early findings. But to just ground this study, as many of the pediatricians in the audience know, in the early time period of the well-child visit, when the parents bring in their newborn baby, much of our focus is on feeding, infant weight, sleeping, pooping. Much less is about brain growth and infant learning and learning to talk. And you can just see from our study sort of the breakdown that we've found in our study of what pediatricians talk about early on. This is quite typical. But then we need to contrast that in the study of what parents know, because interestingly, there continues to be misconceptions that exist around early learning and early language development in our populations. As you can see, that there continues to be misconceptions related to the learning of language in the first 6 months, the impact of educational TV. And why is this important? The Speak, by the way, is a tool that we've developed in our program that measures parents' knowledge and beliefs of early language and learning. And the reason this is important is that we've found in our data that the Speak score, the parents' knowledge at their 1-week visit, actually predicts the nurturing behavior and facilitative behavior that they have at 9 months with their infant. So this is an important concept for parents to understand. So what have we found in our study? This study is looking at the impacts of intervention on parents' knowledge and beliefs based on the Speak. And you can see, unfortunately I don't have a pointer, you can see that at baseline, so the orange line is our control group and the blue line is our experimental group. And what you can see is at baseline, at 1 week, both groups pretty much know about the same amount of information. Then 6 months after the intervention, you can see in the control group that they're pretty stable in terms of what they know. What we found is having more kids doesn't make your Speak score go up, having them longer doesn't. It's a pretty stable construct. But what you can see is in the experimental group, 6 months after the intervention, they've significantly increased their knowledge, and that remains fairly stable to 7 months. We'll have more data in the future. But then what about behavior? Knowledge is one thing, but really what we're trying to impact is behavior. And we've had some recent exciting results looking at changes in behavior at 9 months of these children. And we used an outcome measure called the NCAST, which is basically a video measure of parents' nurturing interaction, such as parents' sensitivity to cues, response to children's distress, socio-emotional growth fostering, and cognitive growth fostering. And, and what we have found, is that individuals in the experimental group significantly increase their sensitivity to their children's cues, their socio-emotional growth fostering, and their cognitive growth fostering behavior with their children. And why is this important? Obviously, we're about nurturing behavior between parent and child, but the NCAST is actually a validated tool that is connected to longer-term child outcomes. Obviously, we have much more data to collect, but this is quite promising. And then in terms of child outcomes, what we've found is those children in the TMW group at that same time period provide much more clarity of cues, which is early communication. And so sadly, because I don't have much time to go into detail, I just wanted to share some of this exciting and promising results. Now moving to the next pillar of our center, community-wide demonstration project. As many of you all have seen, we recently announced a very exciting partnership with the Children's Services Council at Palm Beach County. Through this partnership, we're going to embed a number of our interventions across the health, social service, and education systems, really to hopefully develop one model that could be potentially replicated. Our goal ultimately is to reach at least 60% of the birth to 3 population within 5 years, with at least one intervention and a significant number of children receiving more than one intervention. While we don't have time to go into the details of this model, this slide gives you sort of a snapshot of what we're thinking about in this community-wide model, where the entry point is healthcare as well as an anchor, but then it goes out into the community through home-based and group sessions. So back to our conference today. As I shared, one of our main strategic priorities is really being part of advancing the field, partnering with you all to make a difference. And we see ourselves doing this in 2 main ways. Scholarship with my partner, John Liss, the economist, who is really focused on working on advancing the science of using science, as he likes to say, within the early childhood space. Another way to say it is advancing the science of scaling, to develop models and evidence around the conditions that are necessary for scaling effectively. And what's very exciting in the, I think, second part of our conference is the discussion related to scaling. And then secondly, leveraging our resources at the University of Chicago and our networks in health, education, economics to advance new thinking around how parents and caregivers can best support to have an impact on children's lives, beginning at birth, and how we can importantly use science to advance this work. Convening you all today is an important first step, and we are incredibly thankful that you are part of it. So, what can we expect today? Our hope for today is that we will build a common understanding of the broad landscape of healthcare and healthcare policy as it relates to children, particularly children growing up in low-income communities. We'll then dive into the challenges of scaling interventions, specific interventions that work through the healthcare sector. And finally, we'll connect all of this work in long-term outcomes. Finally, before we go on, a few little housekeeping notes. Our conference is being live streamed in a room upstairs and virtually for those who couldn't make it. All of our sessions will take place in this room. During breaks and lunch, feel free to mosey around. They've got a very cool museum related to the Becker-Friedman Nobel Prizes that you can sneak into. We have a pretty tight agenda though, so we'll have staff stationed all over to help you move from place to place to stick to our time. And if you have any questions or need directions, please feel free to ask one of our staff members. They've got a big name tag that says staff. Finally, our team will be on Twitter today. This is a foreign concept now. Feel free to tweet at us at TMW Center and using the hashtags listed below. With that, I want to thank you all for being here. It should be an incredibly exciting day of lots of discussion. I just wish we had more time to sit and talk, but thank you all, and we look forward to going through it with you today. So with that, we will start the first part of our conference. I'd like to now welcome the esteemed trio who will be discussing understanding the U.S. healthcare system, incentives, motivations, and opportunities. If you all will come join us up on the panel, and I'll introduce you all. And I want to say a special shout out to Perry Class, who had the brilliant idea of this overarching frame of understanding the healthcare system in 15 minutes or less. One more housekeeping. I'm not good at housekeeping, obviously.
One more housekeeping announcement. We are going to try to make a little more space for people. So if there's an open seat next to you, if you would be willing to kind of scoot in so that the seats on the aisle are open, then we're going to have a few more people joining us. Thanks.
Wonderful. So first up, we have Diane Alexander, a wonderful economist at the Federal Reserve Bank. Diane's research predominantly is in healthcare, studying the determinants of the provisions of healthcare services and the action of healthcare providers. Currently, her work investigates the role played by new types of providers in the healthcare delivery, focused on retail and urgent care clinics. Additionally, she is studying the effect of excess diesel emissions from Volkswagen emissions cheating scandal. Wow, that could be very exciting, on the birth outcomes in child health. Next up, we have Donna Cohen-Ross, the Vice President of the Center for Study of Social Policy, where she leads the work of the Young Children and Families team. In the past, Donna was principal at Health Management Associates and served as Senior Policy Advisor and the Director of Enrollment Initiatives at the Center for Medicaid and CHIP Services at the U.S. Department of Health and Human Services. Donna also directed the Outreach Division at the Center on Budget and Policy Priorities, where she improved access to public benefits for eligible families and individuals through policy development, advocacy, and outreach. Lastly, to round out this truly incredible trio, we have Joslyn Dyer, the Managing Director at Monad Health. Joslyn provides policy analysis, strategic advice, and technical support to states, foundations, and a range of clients on the successful implementation of the Affordable Care Act, delivery system reform, Medicaid, and CHIP. In the past, Joslyn served as advisor to the National Academy of State Health Policy and the American Academy of Pediatrics, was a founding member and co-executive director for the Center for Children and Families, and a senior researcher at Georgetown University. Additionally, she was an associate director with the Kaiser Commission on Medicaid and the Uninsured, and served as a legislative research assistant to the late Senator Daniel Moynihan. That is so incredible. You'll have to tell us more about him. So it's going to be a very stimulating and exciting discussion. After we hear from all three of them, I'll have a few questions to get it kicked off, and then we'll open it up to all of you all, and those in the live streaming room. We will have two of our staff members stationed in this room as well, in the live stream room as well. For those in the live stream room, if you would write down your questions on the note card and hand them to the staff. So with that, we will kick off this panel. Thank you so much.